Hi, I'm Dr. Sundin at the Virginia Institute of Plastic Surgery, and today we're evaluating a patient for liposuction. This is Melissa. What can we do for you today?
Well, I am interested in doing liposuction, definitely on my back, possibly on my abdomen.
Okay. Now, have you ever had anything done before there?
I have not.
Not even cool sculpting or anything?
Oh yes, I have done cool sculpting on my abdomen.
All right. Did you see any results from that?
I did, but just not.
Well, more, huh?
Yes, I
All right.
definitely want more.
And have you had kids or anything?
I have not.
How old are you?
I am 37.
And have you ever really been overweight? You don't look overweight now, but have you ever weighed significantly more?
I have fluctuated. I feel like I stay pretty stable though, and I've just always felt bigger than most people.
You don't look very big, but I guess,
thanks.
and that's what really body contouring, whether it's liposuction or cool sculpting, is really good for. It's not for global fat reduction. It's for those areas that are just diet and exercise resistant, especially as we get towards middle age or after hormonal changes. They really get hard off. You almost got to starve yourself to get rid of them.
Right.
Okay. So you kind of want your front and your back. So that's kind of what we refer to as slang-wise as liposuction 360 these days.
Right.
You know, different meanings, different places, but that means in my book that we suck your abdomen, your love handles, your lower back, and your mid to upper back. So for liposuction 360, I generally recommend general anesthesia. You know,
Okay.
I do a lot of liposuction under local, and it's great for targeted areas, but that much liposuction is much more comfortable if we just put you to sleep, and I can be more aggressive with it.
Okay.
And then in fact, there is a toxic limit to the local medication we can't use. So doing large volume areas is sometimes ill-advised, okay? So if I do general anesthesia, I take you down to one of our surgery centers or hospitals, and we have board-certified anesthesiologists take care of you. It's outpatient surgery, it's very safe, you can go home the same day, unless it's an extremely large volume case, which your case I doubt would be. Large volumes usually defined as greater than 5 liters. In those instances, we have to keep patients overnight to hydrate them.
Okay.
Okay.
So what can I expect after?
After, it really depends on how big of an area we're doing. You know, if we're going to do your stomach and your back, the typical LIPO 360, as they call it, it's a little more intense. You're probably looking about 5 to 7 days off, but you're not bedbound that whole time. You're probably really only in pain the first night, you know, significantly, but you're going to be feeling sore, like a bad bruise or workout, and you're probably not going to want a 9 to 5 for about 5 to 7 days afterwards.
Okay. Will I be wearing compression?
Yes, after liposuction, compression is vital. Okay. Typically, patients wear it for a month afterwards in my book.
4 weeks?
2 weeks is critical, but a month is better. And it really helps to have the skin stick down to the body appropriately and to kind of smooth out the result, all right? It's a love-hate relationship. You think it's going to be annoying to wear it, but actually you'll find that you have less pain, less soreness when you wear your appropriate compression.
Okay.
Now, no one's perfect, don't get me wrong. You will be ripping it off in the middle of the night some nights, but you'll find yourself putting it back on about 2 hours later because it is hot and uncomfortable sometimes, but you know, you'll find as soon as you take it off that you actually start to hurt a little bit more. We also sometimes recommend these radio frequency massages afterwards. We use a system called the Vienna system here. I use this instead of lymphatic massage. I think it works better, but it helps to alleviate some of the swelling, lumps and bumps, breaks down scar tissue, and it generally feels good. I normally recommend at least 1 a week for about 4 weeks. So, Melissa, tell me what you don't like.
Okay, so I feel like there's improvement that I could do on my abdomen.
Mm-hmm.
But my biggest concern is on my back. It is my bra fat area, basically. I don't like the skin and the fat that I feel like hangs out of my bra line.
Yeah. Well, this is a common area that's a problem in women. It is a role that everyone has. You know, it's a laxity of skin there as well as some fat. So that's definitely something we can improve. We can't completely cure it with just liposuction alone, even with heat treatments such as J-plasma or Nuvion. But it's not really worth cutting out anything back there for the majority of patients, all right? Okay. Now, where I tell what is fat and skin is really by pinching it. So if I pinch here, you've got just pure skin, whereas if I pinch here, you can tell that there's fat underneath, and that's what I really can get with liposuction.
Okay.
Right. In this area, the flank area is really where you're going to see the best improvement. It's going to really bring in your waist and cinch it there.
Okay.
But there's definitely fat we can take here. We can take some fat here. You know, you're not a bad candidate for any of this. It's just that you got to realize what is skin and what is fat. Okay. It's definitely not worth it at your stage to put any scars on your body to tighten up the skin, okay? And, you know, by the way, the liposuction scars are just going to be in the panty line, in the belly button, so very well hidden, okay?
Okay.
All right.
And how long do they take to heal?
Well, sutures stay in about 7 to 10 days,
Okay.
but over the course of about a year, they fade. And they're really fairly tiny. They're hard to find after about a year, okay? So we're just going to mark the areas that we're going to treat during surgery. These are reference marks. They're like a topographical map. They are not incisions, but they show me where the fat is when she's laying down. As we all know, everything looks better laying down, so things change. So that's one of the difficult things about plastic surgery is we have to work on patients when they're in a different position from the upright. So our marks are critical, okay? So just gonna mark the midline here. Mark this kind of main area of fat on the stomach she's got. Okay, a little bit more down here, a little bit up here. Mark her rib cage. And lift your arm up just a little bit. And here's going to be the best part. This kind of flank region. Feel like you're in a sorority? Okay, now turn around for me. Okay. And so we can kind of emphasize the bottom by where we don't liposuction. And that's half the key of some of these butt enlargement surgeries is more where you take away the fat than where you put it. That'll just be a little incision here, a little incision here. And then for the bra fat area, I'm not going to take a bra off right now, but you can kind of see it. With liposuction, all this area up into the axilla here and over onto the side breast, okay? So that will help to tighten up this area and get some of the fat gone, all right? And we'll put a little scar for her in the bra line there. So incisions tend to be well hidden in clothing areas, all right?
I'm hoping to get out of this just to feel a little bit better in my clothes, to feel definitely more confident in my bathing suit, just to have outfits fit me better, and hopefully to be a little bit tighter when all this is done.
All right, so thanks for joining us on Melissa's journey through our liposuction process here. We're going to go off to surgery and we're going to keep you appraised of a follow-up and show you some more videos and photos of that as well. If you are interested in having liposuction or a surgical experience with us, I hope this gives you some insight into our practice and what the experience is like, and we'd love to see you.
So I had my liposuction procedure done about 7 weeks ago. The recovery was easy, uncomfortable, but nothing that stopped me from doing anything. I was only out of work for 3 days. I wore some compression. That was probably the uncomfortable part, just kind of being a little stiff, but nothing that caused any issues or stopped me from going about my normal day. My results have actually exceeded my expectations of this procedure. I went in thinking, oh yeah, I'm sure I'll get some type of improvement. And it is beyond what I expected. So I am thrilled with my new body. I would highly recommend Dr. Sundin. The Virginia Institute of Plastic Surgery, it's just, everyone here has been super nice. The nurses were constantly checking on me afterwards. The doctors were constantly checking on me afterwards. My results, like I have said, have exceeded my expectations. The recovery was super easy, and it's well worth it. I would recommend this procedure and the doctors to anyone who was interested in having liposuction done. I am in love with my results. I actually just went to Costa Rica. I got back a couple of days ago, and for the first time ever, I was completely comfortable walking around in a bathing suit. I didn't feel like I needed to cover up. It's given me so much more confidence.